What would lead a doctor to suspect mental toxicity in a patient? Many chronic conditions such as fatigue, fibromyalgia, digestive ailments, autoimmunity, neurodegenerative disorders, and others have a component of mental toxicity and should be evaluated for an underlying toxic influence. A diagnosis of mercury toxicity is still a matter of clinical judgment. Clinical tests plus clinical symptoms paint a picture. The presence of a mercury body burden, measures of mercury retention, along with associated symptoms suggest the diagnosis.
However, properly diagnosing adverse health effects related to dental and mercury amalgam fillings is impeded by the intricate list of potential responses to the elemental form of the substance, which include over 250 specific symptoms. This is from K.M. Rice et al., Journal of Preventive Medicine and Public Health, 2014 March. The table shown here is a brief listing of some of the symptoms most commonly associated with inhalation of elemental mercury vapors, which is the same type of mercury continually emitted from dental amalgam fillings. Just read each row from left to right, alphabetical order, by only narrating the topic in bold. Oh, it's for me. Okay. Acrodynia, anorexia, cardiovascular problems, cognitive neurological impairments, delusions, delirium, hallucination, dermatological conditions, endocrine disruption, erethism, fatigue, headaches, hearing loss, immune system impairments, insomnia, nerve response changes, oral manifestations, psychological issues, renal or kidney problems, respiratory problems, shyness, tremors, weight loss. In addition to understanding symptoms of mercury exposure, it is important for dental professionals to understand the basics of testing for it. This aspect of oral health integration is especially important because a growing number of patients are seeking out biological dentists to remove their mercury fillings as part of a detoxification program. More specifically, in some cases, a healthcare practitioner recommends mercury-free dentistry to assist the patient in recovering from a medical condition or in achieving a more optimal level of well-being. IAOMT encourages oral health integration, which connects oral health to overall health and vice versa. What this means is that many IAOMT dentists and biological dentists work with patients' physicians who are conducting heavy metal testing. Since each health professional has preferences for the testing that they use, it is helpful if biological dentists learn about all of them to better serve our patients. There are a variety of commonly used tests for mercury exposure, and there is no general consensus right now as to which test is best. Health professionals have different opinions about this. So, as a biological dentist dedicated to working integratively with other health professionals, you should be familiar with the range of tests doctors are currently using, which include the following. Diagnostic tests for mercury exposure. Number 1, hair analysis. Number 2, urine mercury, which tests for lead, copper, tin, and albumin testing, and urine mercury porphyrin profile. Number 3, fecal metal screen, not very common. Number 4, intraoral mercury vapor levels. Number 5, blood mercury levels. Really, these are only good for measures for recent high-level exposure. Number 6, mercury levels in saliva. Number 7, cysteine and glutathione status. Number 8, the tri-test, which uses samples of blood, hair, and urine and distinguishes between different types of mercury. Number 9, mercury challenge or mobilization testing, which uses a drug to provoke release in urine. One of these is called the British anti-leucite, BAL, or dimercaprol. Penicillamine, 2,3-dimercaprylsuccinic acid, which is DMSA. 2,3-dimercapto-1 propanosulfonic acid, or DMPS. Allergies merit a separate discussion because diagnosing a mercury allergy can involve the use of additional types of tests. Health conditions linked to dental metal allergies or hypersensitivities include autoimmune disorders, fatigue, multiple chemical sensitivities, oral lichenoid lesions, and even infertility. For this reason, documenting metal allergies can also be an essential diagnostic tool. The most common test for mercury and metal allergies is skin patch testing. However, that exposes patients to the suspected allergen. Two relatively new alternatives to skin patch testing are a modified version of the lymphocyte transformation test, LTT, and the lymphocyte response assay, LRA. Dental biocompatibility testing is also used to assist in establishing which products and materials are more compatible for each unique dental patient. If biological testing is used, a patient's blood sample is sent to a laboratory where the serum is evaluated for the presence of IgG and IgM antibodies to the chemical ingredients used in dental products. The patient is then provided with a detailed list of which name brand dental materials are safe for their use and which ones could result in a reaction.